So we have already learned the basics of the phacoemulsification technique. Now what we have to do is actually apply it to different situations while doing cataract surgeries. As we all know that different nuclei are different. When we are faced with cataracts, some of them are soft, some of them are hard, some of them are nuclear, and some of them are brown. The techniques vary from patient to patient and from nucleus to nucleus. So we'll be seeing some videos where we can apply these techniques. So as you can see over here, this patient has a posterior polar cataract. So the amount of ultrasound energy or phaco power or aspiration that you use will be different from the cataracts that we saw in Sir's earlier videos. The procedure begins as any other case by doing a tunnel and then a capsulorhexis. In these type of cataracts, there might be a pre-existing rent, so a standby system for vitrectomy is necessary. So you do a careful hydro procedure. As you can see here, you can see the formation of a golden ring. The golden ring suggests that you have a complete separation of the nucleus by the hydro procedure that you have already performed. This procedure helps to separate the nucleus, but we are doing it carefully in this patient because if there is a pre-existing rent, then it can expand. When we start phacoemulsification, as you can see over here, the nucleus is so soft that while trying to trench, it forms a cavitation. So we understand that it is going to be impossible to try and divide this nucleus into two pieces because while doing phacoemulsification, there is a cavitation effect. So what we now have to do is abandon trying to remove the nucleus, and rotating the nucleus helps to make us do a carousal technique, and the nucleus is now emulsified as a whole. So it is important to change your technique according to the softness or the hardness of the nucleus, because as you know, in this patient it was impossible to divide. So even in the beginning, what we could have done was just separated the nucleus, lifted it completely like a salute, and then emulsified it as a whole in phaco position 2. This technique that we are demonstrating is bimanual irrigation and aspiration of the epinucleus. As you can see over here, we used very little hydrodissection because we were scared of a pre-existing rent. So a large epinuclear buttress remains. You can see the AC maintainer which is in place and very comfortably with an aspiration cannula, and the complete epinucleus with the cortex is removed. This is a very safe procedure. It keeps the bag inflated and does not allow the bag to collapse because of the continuous infusion from the AC maintainer, and a complete 360-degree removal by using all the three ports and exchange of the ACM is possible. So as you can see, the cortex can be aspirated and a complete cortical cleanup is possible. You know, the AC maintainer and the aspiration can interchange ports for 12 o'clock or some subincisional cortex. Also, the anterior capsule can be polished, and now the lens is inserted for a complete and a wonderful phacoemulsification. So this is the second case. But the nucleus again is different, and what you can see is that we are embedding the nuclear tip into the substance of the nucleus using the chopper which comes from the opposite direction to make a direct chop. This is also called as a Nagahara's chop. These type of chopping techniques are used when you don't want to use a lot of energy to trench the nucleus and to reduce your phaco time. This is used in cases when nucleus are hard, but you have to remember that you have to use a lot of aspiration here, higher than what you would normally use, to embed the nucleus and make multiple pieces. The basis of this technique, like you know, is that you cannot eat an apple completely. You have to chop it in multiple pieces so that the pieces can be put into your mouth. So this is the basis of phacoemulsification, and we are using all the techniques which have been described by Lahane sir. As you saw, that all the words that we use, the followability, the nucleus pieces which are sucked into the phaco tip is the followability, and the rest is chopping and cutting. So you know that this was the second technique, or the straight Nagaharas chop, which is used to emulsify the nucleus. And in this technique, the amount of phaco power used to trench the nucleus is less. In learning the Nagaharas chop, a little bit of effort, because in case you do not know the chop and you try to use less power or aspiration to keep the nucleus sucked to the phaco tip, and if you try to separate it, you might cause a zonular dialysis. The optimum use of power and aspiration is very important for these techniques. This is a technique which we use daily, and this is called as the stop and the chop technique by Paul Koch, which has been described. So what is a trench? Sir has already said that when you emulsify the nuclear material, it is called as a trench. By trenching the nucleus, you create a wall so that the nucleus can be divided completely. Now, that was the first division. After the first division, the nucleus is rotated, brought in front of your phaco tip, and the part of the nucleus, the half of the nucleus, is again divided into two. So now this is the second part of the phacoemulsification, where one piece is removed. The first division is very, very important, and the trenching is very important, because when you create a deep trench, and when you see the glow, that you know that a greater wall of the nucleus has been emulsified, the nucleus can be divided. This is the second part of the nucleus, which is rotated, brought at 6 o'clock to face you, and then again a small trench is made, and this piece is divided again into two parts. So this is a stop and chop technique, in which the first trench is made to make the first division, where your phaco energy is higher and the aspiration is lesser than in 2. After the first division, 2 is used to make 4 pieces. So this is the most commonly used phaco technique today, that is a stop and chop technique. So we've learned that there are 3 techniques in vogue. One is the stop and chop technique, one is the Nagaharas technique, and one in cases of soft cataract where none of them will work, because once you try to pass your chopper through the nucleus substance, it will be passing through it. So where we remove and rotate the nucleus completely and bring it out. So I will be showing you a case. Okay, so this is a case where we can see some of the techniques as we saw earlier. So you make a tunnel. A corneal tunnel is made. It is made by using a crescent and a 3.2. You have to remember that square incisional geometry is very, very important for making the tunnel. Yes. So square incisional geometry is very important in making the tunnel to get rid of astigmatism. Blurex is used, as you can see, because the cataract is appearing to be white, but inside the nucleus is hard. Blurex helps us to make a complete capsulorhexis in case where there is no contrast in case of mature cataracts. A very, very, very diligent hydro is made because the nucleus is hard and the PC can be thin. Superficial cortex is emulsified so that there is access into the substance of the nucleus. You can see carefully that the nucleus is embedded by the phaco tip. After you get a hold, the chopper is used to divide the nuclear substance into straight 2 pieces, which is the first division. Now again the phaco tip is embedded and the chopper is used to separate more pieces and create more pieces so that smaller pieces can be easily occluded and emulsified by the phaco and aspirated. So the chopper is used to rotate the nucleus, to keep the pieces from banging into each other, And the chopper is also used to create the small pieces by chopping the nucleus substance mechanically. What is important over here is the hold or the followability by a good machine with good aspiration, which keeps the nucleus piece occluded or held to the phaco tip, so that once that hold is there, you have to hold something in order to chop it properly. The same principle applies over here. So the nucleus is chopped, and then each piece is brought in front, rotated and brought in front of the phaco tip. Once occlusion occurs, it is emulsified, and then the small pieces of the nucleus are aspirated through the system, giving in effect a complete surgery. As you can see over here, that we did not move from the circle of safety. The circle of safety is the rhexis, so that it is not necessary to use or to run from one end to the other with the phaco piece, but the phaco piece remains in the center within the circle of safety, and the chopper is used to rotate the pieces and to bring it towards the phaco tip, because moving the phaco tip can be very, very dangerous and can cause problems. So, do I have time to show one more video?
Yeah, you can show.
So we'll be seeing one more video over here of the the direct chop technique, because we already know the trench that we've already been doing. So as you can see, watch carefully that the nucleus is embedded, some part of phacoemulsification is done, and you can see the nucleus, the tip there advancing slightly. So when you embed the tip, at the site, phacoemulsification is done so that it remains embedded into that part of the nucleus, and then it is chopped. But just remain superficially and touching the nucleus without phacoemulsification will cause the nucleus to slip. So then once you have embedded the nucleus and done phacoemulsification with enough power and aspiration, then as you can see now, this is phacoemulsification and embedding, then use of the chopper from the opposite direction to create a piece, then rotating and taking away the piece to the side and bringing the other part of the nucleus in front of you, again embedding, chopping, creating a piece, rotating it and keeping it to the side, again bringing a piece. So this is a technique by which you are rotating the nucleus, making small pieces, keeping the pieces to the side. And a complete, see, the piece has to separate from posterior. The posterior plate also has to separate, but without any untoward movements. These pieces are now separate, because if you're not rotating the nucleus in the same plane, trying to rotate it in any other way, the pieces will wobble against each other, and one of the sharp pieces will tear the posterior capsule. So rotation in the same plane, complete separation of the pieces in such a way that the posterior plate also separates. So holding it in such a way and rotating it in such a way that there is complete separation. Now you start emulsifying one piece by one. I'm sorry, something in the system which does this. So you now have one piece. You know all the pieces are separate. In stop and chop, you make 4 pieces. But when the nucleus is hard and it is bulky, then you make more than 4 pieces. It is so simple, because then you get smaller pieces which can be occluded by the phaco tip and emulsified. So depending on the type of the nucleus, the hardness of the nucleus, the bulk of the nucleus, the phaco technique is modified in order to effect a good and a complete phacoemulsification, keeping in mind the safety of the corneal endothelium and the ocular tissues, staying away from the posterior capsule so as not to get a PC rupture, and getting good and fantastic results. That is because patients come to us with lots of expectations, but the technology is such that it can be used safely and effectively to get the results which are desired by us and by the patients. So as you can see, these are the last few pieces. One has to be very careful, because there is no epinucleus buttress in these type of mature cataracts, so that when you are doing the last piece, there might be a surge, because there is no volume and there is there is nothing to occlude the phaco tip, and there might be a sudden surge. So when you are doing this piece, and you know what, there is always a relief in the surgeon's mind that thank God it's over, and you may make a mistake at this time, which is what I have done. After doing mad cats and brown cataracts, I have heaved a sigh of relief only to see the PC getting captured in this and getting a PC rupture. Once this piece is gradually, as you can notice, the piece is in the center, but all the pieces or the small pieces are coming towards because of a good aspiration system. So you just have to stay in the center. They all come towards you and they can be emulsified. At this point, you have to take a 1 minute break and gently change your foot pedal to aspiration and then to irrigation and come out of the eye without hurry, to ensure that there is no PC tear. Thank you so much, friends,
Thank you, Dr. Ragini, for the